Welcome back to the News Wrap. President Joe Biden signing multiple executive orders and laying out the federal plan to tackle the coronavirus pandemic this afternoon. The new president vowing to take more aggressive actions to contain the virus than his predecessor, but warning there are still dark days ahead. Here to discuss is Anna Bershteyn, infectious disease expert and assistant professor of population health at New York University's Grossman School of Medicine. Anna, welcome, welcome. Such an important subject, such an important day. We know President Joe Biden's COVID-19 response is already underway. He really wasted no time. What challenges could he face in slowing the spread of this virus?
We are coming from quite a dire situation. Roughly 4,000 Americans dying every day from COVID-19. And the death toll is projected to approach 500,000 in coming weeks. So the challenges abound right now. And I think we see that in the number of executive orders that have been issued around COVID, starting with just the fundamental prevention, getting masks worn wherever there is jurisdiction for the federal government to mandate masks to be worn, for example, in travel and on federal property, paying attention to occupational safety standards so that people who work in jobs that involve risk of COVID can have protection measures in those circumstances, making sure we don't run out of supplies for things like masks and syringes, things that we will need to deliver prevention and life-saving measures. And then, of course, the commitment to roll out vaccines as quickly as possible. So lots of monumental challenges, every piece of that really critical to contain the pandemic.
Yes, it's critical and quite the undertaking. And I wanted our viewers to listen to what Anthony Fauci said in a White House press briefing this afternoon about the efficacy of vaccines against these mutant strains. And I'll talk to you on the other side about it.
Right now, from the reports we have, literally as of today, it appears that the vaccines will still be effective against them. With the caveat in mind, you want to pay close attention to it.
Pay close attention to it. What is your response here?
So as far as we know, some of the strains that we understand best in terms of being more transmissible should still be able to be prevented through vaccination. But there are more mutations out there that we don't know as much about. One that I've had my eye on is called E484K. Every time I read it, I think, eek, because we have so much to learn about that mutation. And there is some concern, a lot more to learn about whether it will change the ability for someone who has had COVID to still be immune to that variant, as well as what that could mean for vaccines. We just don't know right now. But the other thing, so the variants are doubly concerning because we have to keep watching to make sure that we're finding out if there are variants that escape immunity. At the same time, there's pretty good evidence now that variants that are all over the United States are more infectious. And so that's a problem for vaccines. It's a problem for all of us because it will accelerate the pandemic. It's a challenge for vaccines because it raises the threshold for herd immunity. So you may have heard that 60 to 70% of us would need to be immune in order to have herd immunity. But a variant that's more contagious, about 50% more contagious, would raise that level to something like 80%. So that means even more of us need to get vaccinated as quickly as possible.
That is disturbing. And we know the push to inoculate Americans is hitting a roadblock after several states are reporting they're simply running out of vaccines, and tens of thousands of first dose vaccine appointments are being canceled. I've had friends who that's happened to here in New York. So what could be the outcome if delays like this continue, Anna?
Well, one thing to remember is right now, with a more infectious variant emerging in the United States, we're in a race against time to vaccinate as much as possible as this variant is emerging. And that means we need vaccines to not sit in freezers. We need vaccines to get into arms. So when New York recently expanded eligibility for vaccines to anyone age 65 and older and in certain classes of occupation, that made a lot more people eligible than there are vaccines. And what that does is it helps us to vaccinate faster, to get vaccines out of freezers and into arms as quickly as possible. So sometimes that will mean frustration, appointments postponed because there is not enough vaccine on the day that an appointment is made. But a positive way of looking at that is if the getting into arms is always keeping pace with the vaccines that we are getting from the manufacturers and from the federal government, it means that states are doing everything possible to slow down the pandemic and to slow down these more infectious new variants.
We know the U.S. is rejoining the World Health Organization. How will the global effort to fight the spread of COVID-19 be affected or change, Anna?
I think it's critical. It's a global pandemic. Science is a global phenomenon, and so much of what the World Health Organization does allows countries to coordinate around situations like this. So on the one hand, an innovation in one country, a new type of vaccine or another scientific breakthrough can flow to other countries through that global coordination. At the same time, as countries see things like new variants, new mutations in the virus, international collaboration gets that information around the globe faster. Even before COVID, the World Health Organization had a really important role in making sure that influenza sequences, as new flu variants emerge every year, get spread across the world, and that information gets to vaccine manufacturers. And now we have even more of an impetus to collaborate and coordinate, because the great thing about science and knowledge is that it's catalytic. So we want to make sure that all the knowledge, all the science, all the breakthroughs can benefit as many people as possible.
Anna Bershteyn, infectious disease expert and assistant professor of population health at New York University's Grossman School of Medicine. Anna, we really appreciate your time and insight today. Thank you so much.